Canine respiratory diseases are a common problem, affecting dogs of all ages and breeds. The causes of these diseases can be varied, but they can generally be classified into three main categories: infectious, inflammatory, and structural. Infectious causes. The most common infectious causes of canine respiratory disease are viruses and bacteria. Viruses such as canine distemper virus, CDV, and peri-influenza virus can cause severe respiratory infections, while bacteria such as Bordetella bronchoseptica and Streptococcus pneumoniae can cause pneumonia. Canine distemper virus, CDV, is a highly contagious virus that can cause a variety of symptoms, including coughing, sneezing, fever, and lethargy. CDV can also affect the nervous system, causing seizures and other neurological problems. Canine distemper virus, CDV, in dogs Uverdens u Nouvelle Phénidrine, Wikipedia, org. Canine distemper virus, CDV, in dogs. Peri-influenza virus is another common cause of canine respiratory disease. This virus is less contagious than CDV but can still cause serious illness, especially in young puppies. Symptoms of peri-influenza virus infection include coughing, sneezing, and a runny nose. Bordetella bronchoseptica is a bacterium that is commonly found in the noses of dogs. This bacterium can cause kennel cough, a highly contagious respiratory infection that is characterized by a harsh, honking cough. Streptococcus pneumoniae is a bacterium that can cause pneumonia in dogs. Pneumonia is an inflammation of the lungs that can cause cough, difficulty breathing, and fever. Inflammatory causes. Inflammatory causes of canine respiratory disease are caused by an overreaction of the immune system. This can be triggered by a variety of factors, including allergies, exposure to irritants, and certain medications. Allergies are a common cause of canine respiratory disease. Dogs can be allergic to a variety of substances, including pollen, dust mites, and mold. Symptoms of allergic respiratory disease include coughing, sneezing, and wheezing. Exposure to irritants can also cause inflammation of the respiratory tract. Irritants such as smoke, dust, and chemicals can cause coughing, sneezing, and difficulty breathing. Certain medications can also cause inflammatory respiratory disease. Some medications, such as aspirin and ibuprofen, can irritate the lungs and cause coughing and difficulty breathing. Structural causes. Structural causes of canine respiratory disease are caused by physical abnormalities in the respiratory tract. These abnormalities can be congenital, present at birth, or acquired, developed later in life. Congenital abnormalities are caused by problems with the development of the respiratory tract. These abnormalities can include tracheal collapse, which is a narrowing of the trachea, and pulmonary hypoplasia, which is underdevelopment of the lungs. Acquired abnormalities are caused by injury or disease to the respiratory tract. These abnormalities can include tumors, foreign bodies, and scarring. Treatment. The treatment for canine respiratory disease depends on the underlying cause. For infectious causes, treatment may include antibiotics or antiviral medications. For inflammatory causes, treatment may include corticosteroids or other anti-inflammatory medications. For structural causes, treatment may involve surgery or other interventions. In addition to specific treatments for the underlying cause, there are also a number of supportive care measures that can be used to help dogs with respiratory disease. These measures may include rest and hydration, humidification of the air, oxygen therapy, nutritional support with proper treatment, and supportive care. Most dogs with respiratory disease can make a full recovery. However, it is important to note that some respiratory diseases, such as CDV, can be fatal. Prevention. There are a number of things that can be done to help prevent canine respiratory disease. These include vaccinating dogs against CDV and peri-influenza virus, limiting one's exposure to allergens like dust and smoke, using caution when administering medications to dogs, regularly checking dogs for signs of respiratory disease. By taking these preventive measures, you can help to keep your dog healthy and free of respiratory problems. AA